Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop lumbar radiculopathy pain. But before I do that, I'm gonna go over the symptoms, the causes, risk factors, and what you should do at home to relieve or stop lumbar radiculopathy pain. What is lumbar radiculopathy? It's basically pressure on the nerve root that caused by damage or inflammation that actually causing pressure on the nerve, which cause numbness, tingling in the thigh, leg, buttock, or ankle and knee, foot areas. And you can see it here, especially if the radiculopathy causing sciatica, the pressure gonna cause radiated pain going down to the leg, the thigh, the ankle. And that's basically inflammation and damage that compressing on the nerve. So symptoms, you might experience tingling, numbness in the foot, ankle, thigh or knee area and the buttock area. Also, you might experience some weaknesses in your lower extremity and loss of sensation. One of the common reasons for lumbar radiculopathy is degenerative disc disease. And you can see on the left side here, image, there's no degeneration, so the vertebra look nice and smooth here and the disc look healthy here. And when we compare it to the right side, you can see the uneven surfaces, degeneration, wear and tear, and usually that happens with osteoarthritis or age. And that degeneration could compress on the disc and also could cause compression on the nerve ending here. So you might have the bone spur, or you might have inflammation in the bone of the vertebra itself that compressing on the nerve. And the other cause is herniated disc, and I will show you a top view here. This is a top view from the top. This is the disc and this is the vertebra, and you can see the spinal cord here and your nerve ending here, the nerve root that actually going down to your legs. So when you start to have herniated disc, which mean is degeneration in the disc, this is normal healthy disc here, there is not much compression here, and as you see, there is really very few millimeter space here, so you really don't have enough room for inflammation or swelling or degeneration. When you start to have the herniated disc, the disc start to bulge on the nerve like in this image. And a lot of people do not recognize that that could actually cause by just 1 millimeter of pressure that could cause those symptoms. So it does not have to be a lot of herniation that going to the nerve to cause that symptoms. So this is a back view for the vertebrae, the pelvis here, and lumbar radiculopathy usually occur in this area. And when you have normal disc like here, the nerve is coming out, there is no issue. And you can see here in this model, herniated disc, it's sticking out. And that's inflammation or herniated disc compressing on the nerve here that going down to the leg. So that's one of the reasons is the herniated disc. The other reason, degeneration in the vertebrae with osteoarthritis. And when that happened, that could compress on the nerve too. And one of the other reasons that actually overlooked by a lot of healthcare providers, and I have a video on it, the performance syndrome. So feel free to check it in my channel. So performance syndrome, there is a muscle here that attached from here to here, that's called the performance muscle. And when you start to have a muscle spasm in this muscle, scar tissue, tightness, the nerve that coming down from the lumbar spine into the performance muscle, it's that scar tissue compressing on the nerve in this area, around this area, and that could cause radiculopathy. So that's overlooked by a lot of healthcare providers, and it could be misdiagnosis with herniated disc and actually the pressure could be here, because most of us actually have herniated disc, especially when you get to 40 years and older. That doesn't mean that what compressing on the nerve. There is several areas that could be compressed on. So proper evaluation extremely important, because if you misdiagnosed with false herniated disc and the problem in here, nothing gonna help the symptoms if you work on the wrong spot. So check out the performance syndrome video that I have in my channel. So one of the other causes is whiplash. If you have a motor vehicle accident and you had jerky movement or hit as a result from accidents, that could cause herniation, degeneration in your vertebra and cause lumbar radiculopathy. Also, if you don't have an accident, it could happen over time as a result of poor posture, poor body mechanic, slouching in the front of the computer for hours every day for years, and that's gonna cause degeneration in your vertebrae, and that could lead to compression on the nerve and causing the radiculopathy. Also, if you are required to do lifting at work, or you do a lot of lifting with improper body mechanic, you could injure your back and cause degeneration in your joint and cause inflammation. So poor posture, poor body mechanics are common causes for herniated disc or degenerative disc disease that lead to lumbar radiculopathy. The other causes or risk factors, if you have arthritis or if you have rheumatoid arthritis in the back, that could cause lumbar radiculopathy. So how to treat it? So in order to answer this question, we need to understand the normal healing cycle, so it will make sense what kind of treatment we should do at home to really get to the root cause of the problem instead of just masking the symptoms. So I'm gonna use external paper cut for visualization, but the same process happened internally from accident, trauma, degenerative disc disease, herniated disc, that cause the inflammation in the back, because by definition lumbar radiculopathy is inflammation and damage that compressing and pushing on the nerve. So there's always inflammation in this process. There is a damage could happen internally. So first stage of healing is inflammation. You can see it here, redness, the blood starts to rush to that area, and you start to have warmness in that area and decrease function and increase pain. Second stage of healing is the proliferation stage. During this stage, actually your body builds scar tissue, and you can see it here in the paper cut. If our body does not build a scar tissue, it's open wound susceptible for infection. So actually scar tissue very essential for our survival. We need a scar tissue. The problem is when you have too much scar tissue, especially in the area that's actually you don't have enough room to build the scar tissue, and that's a common cause. So if you have inflammation, swelling in this area, or you have a scarring, that could compress on the nerve that cause radiculopathy pain. Perfect scenario actually during the maturation stage, you can see it in the last image here, your body starts to get rid of the scar tissue, clear up the inflammation, and everything clears up. If you still have symptoms, very high chance you actually stuck between the inflammation and proliferation stage, which means there's a swelling internally, there's a scar tissue, there's fascial restrictions, trigger point, and muscle spasm that could cause the compression on the nerve. So in order for us to treat the root cause of the problem, we need to really look from the healing cycle perspective and address the inflammation and proliferation stage. I'm gonna go over some of the treatment that currently used that doesn't work, and it will make a lot of sense why this treatment does not work when we relate that to normal healing cycle. So you don't have to waste your time on it, and we'll focus at the end on what you should do at home to get rid of lumbar radiculopathy pain or relieve your symptoms. So common treatment that used ice and stem or heat, and that's based on a study, provide temporary pain relief. Does not really do much to really break the scar tissue, release the fascial restriction, or decrease the inflammation. It's temporary. Massage, foam roller, I'm gonna combine those together because based on the study, actually they don't provide any long-term pain reduction. And think about this way: you have internal inflammation. If you keep rubbing it with the foam roller, you're gonna cause more inflammation. And the same thing for massage. The problem with massage and foam roller, when I go over the fascia system, it will make a lot of sense. These are not effective treatment because it's impossible to release deep adhesion with the knuckle if you do massage with the knuckle or the elbow, or the foam roller that actually touch the surfaces. We'll touch base on that when I go over the fascia system. One of the other things that commonly used is stretching, and you'll see a lot of videos on YouTube for stretching. And unfortunately, that's one of the things that actually gonna cause more scar tissue, cause more inflammation. Based on the study, stretching does not really help much, and actually overstretching could cause more inflammation. And I personally don't recommend any stretching for my patient. There's other safe option to do at home. I had patient actually had radiculopathy. They looked at videos to do stretching for the performance muscle and other stretching that aggravate their symptoms, build more scar tissue, and they were not even able to walk after doing the stretching. So please do not do stretching. It's harmful than beneficial. The other thing that commonly use joint mobilization, some call it adjustment or manipulation, and it's used by physical therapists, chiropractor, occupation therapist. And when we start to look at the healing cycle here, joint mobilization, it's basically moving the bone, but that does not do much to the inflammation stage. That's actually, if you continue rubbing it, you're gonna inflame it more. It will not break the scar tissue. And based on the study, it provides temporary pain relief, does not provide long-term pain reduction. The other thing is stretching exercises. But if you do it while it's inflamed, you're gonna inflame it more. It's good to do exercises, but I prefer to do function training, which is more effective than stretching or strength exercises, but I usually do it on the right time. We have to decrease the inflammation first. We have to release the scar tissue that happened internally. So when we do function training, correcting the posture, the body mechanics, it will be easy to implement that and will not causing more damage from the exercises or the training. So what should we do at home to really take care of lumbar radiculopathy? So we have to look at the treatment from inflammation perspective and proliferation perspective. So the first thing I do for inflammation, and it's very common to have inflammation with lumbar radiculopathy, we usually recommend to rest. Don't do the motion that aggravated, like lifting, sitting for a very long time. There's certain motion that actually cause more pain. I will avoid those motions. And I personally gave patient the Magnet Heal 2 to really work on inflammation. This magnet is extremely strong. We measured the field of the magnet is around 3 inches. Magnetic force, which actually can penetrate all the way to the spine and the nerve ending in the back. So that's a very good option. Patient usually wear it throughout the day or at night to decrease internal inflammation. I like to put all my patient on anti-inflammatory diet because there's certain food that actually cause more internal inflammation and slow down the healing cycle. So the other thing that is common with, especially with lumbar radiculopathy and overlooked by a lot of healthcare provider, their body slow to heal because there's a vitamins mineral deficiency, and there's several study shows the process of healing is not gonna move from inflammation to proliferation to maturation unless you address the deficiency you have. So one of the way you can do it today, actually right now, go to askastr.com. It's a free online medical evaluation. The software will guide you through the process of understanding and knowing what possible deficiency you might have. The questionnaire takes about 5 minutes, and at the end there's information on how to address the root cause of restoring vitamins and mineral deficiency. It's free and it takes just a few minutes. So we have to work on a proliferation stage. And in order to do that, we have to work on the scar tissue, the trigger points, fascia restrictions. And that will help to decrease the muscle spasm that compressing on the nerve in the back. So to visualize, when you have internal scar tissue, the far left image here, this is normal muscle. There is no scarring or damage. When you start to have tear, it's look like this. It's random tear tissue. And when your body starts to build the scar tissue, the scarring is actually extremely random, as you can see it here. And as I mentioned to you, you don't have enough room in the back. There's not enough more room. If you have 1 millimeter of scar tissue here, or inflammation, that could cause lumbar radiculopathy. So we don't have enough room for scarring on this area or inflammation in this area. And that's why we need to work on inflammation and scar tissue simultaneously in proliferation stage. And what I personally use, I use the A3 to work on superficial scar tissue, to release the scar tissue superficially. And I use the A5 tool to work on deep scar tissue. But we have to relate that to the inflammation. And in the patient home self-treatment program, I go over how to address that simultaneously without causing more inflammation. So I use the A5 to release deep fascia restriction, deep scar tissue, and deep trigger points. So the other thing that's extremely overlooked is the fascia system. Briefly, I will cover this here because I want you to appreciate the complexity of that system. When you understand it, you will appreciate and you will know why this is extremely important part of treatment and in relationship to the proliferation stage. So the fascia system, superficial layer of the fascia is wrapping the entire body. It's like a Spider-Man suit. You can see it here in this image, the white tissue here, that's the fascia layer. The white tissue here, and here in the cadaver, the white tissue. And actually, to be more relevant to you, you can see it here in the steak. That white filament, that's the fascia. So it's a very important system that causes a lot of health issues or pain and overlooked because there is not a lot of options to treat the fascia system. So you see the white filament here, that's a fascia layer, and we have several layers. To make things more complicated, but don't worry, the treatment is extremely simple. We have two main categories of fascia: superficial layer wrapping the entire body, and we have the deep layers. So each of these layers divided to 2 to 3 subcategories of layers. So the deep layer, we have a layer called the apparatic fascia that's wrapping a group of muscles. Another layer called epimysin wrapping each individual muscle, and the premiysin wrapping a bundle of fibers, and each individual fiber actually wrapped with the endomysin, and you can see it in this image. The epimysin wrapping the muscle, and then a bundle of fibers here wrapped with the premiysin, and the endomysin wrapping each individual fiber. That's why I said massage and foam roller are not effective. Based on the studies, they are not effective. But when we look at the body anatomy, it's impossible with the foam roller just superficially to release deep endomysin, premiysin, and epimysin layers. And even with the massage, if you use your knuckle, it's very thick, that will not gonna go as deep as the A5 to do the deep release. And for the fascia restrictions, if you cannot apply mechanical force, it's impossible to release it. It's similar that you have a screw that you need to unscrew, but the screwdriver is very short. You will not be able to reach to that screw to unscrew it. That's why massage and foam roller will not work to release the fascia restrictions or the scar tissue. So the treatment very simple. So what I personally use, I use the A1 to release the superficial fascia layer and the apparatic fascia layer. and then I use the A5 to release the epimycin, premiycin, and endomycin. Remember, when we work, we need to work on the whole system, the whole problem, because your pain is not only scar tissue, is not only fascial restrictions, it's not only trigger point. You cannot pick and choose, because it's very common when you have lumbar radiculopathy. There is inflammation, there is a scarring, there is a fascial restrictions. They all happen simultaneously. When you start to have a scar tissue, it scars in the fascia layer and make those tissue stick together, glued together. So we need to release those tightness and or that adhesion in the fascia layer, and also we need to break the scar tissue. So what should you do at home? Well, first of all, if you do any motion that's aggravated, you need to stop. If you do a lot of lifting, we need to avoid that. Certain lumbar radiculopathy aggravated with sitting or standing, you want to refrain from the motion that's aggravated. We have to work on your body mechanic and proper lifting and body and your posture. But before I do that, we have to work on inflammation, decrease internal inflammation, and start with the anti-inflammatory diet and release all the tightness in the back. Before doing core stabilization, before doing like pain-free exercises, we have to do the release, decrease the inflammation. So when you do the exercise, it's easy for you to do the exercises and not causing more pain. And that's basically summarize how to treat lumbar radiculopathy properly at home. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.